Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And you know, every once in a while, we do programs which don't talk about heart disease or your pain or whatever, but this could be a real pain if you don't learn to understand the health of our community. And what is more important than community paramedics and first responders? But in order for that to work, you need great public officials like the gentleman who's sitting across the aisle from me here, and that's Michael Ryan, the mayor of the city of Sunrise. Welcome, Michael.
Thank you, Dr. Lippman.
Good to see you.
It's great to be here.
And an old friend of mine. I don't want to embarrass you, Johnny, but I remember you when you were a little guy, and I guess I was younger at some point in time. But there's the Sunrise Fire Department chief. He's a fire chief, and I have so much fond relationship with this gentleman and trying to make your lives safer all over the state of Florida, not only Sunrise.
Thank you.
John K. McNamara, chief of Sunrise Fire Department.
Thank you for having me today,
Good to have you, sir. I know that something's going on in our communities, which the reason I have you here today is because I talk about the healthcare of the community, and I know that you have a community paramedic program that really needs some attention by the viewers, because we need some, I believe, and you can start with your discussions, that they need to understand the problems that are inherent within the 911 system, in quotes, the paramedic issues. And I think in observing and listening to a particular article that you wrote, Mayor, in the Sun Sentinel recently, I think it needed some attention. So I'm putting a spotlight on Michael Ryan, JD, Mayor, City of Sunrise, and tell me about the community paramedic program.
First off, Dr. Lippman, you're absolutely right. This is a topic that really deserves attention from the viewers, but also from Tallahassee. As you know, fire departments traditionally are really part of a risk reduction program, right? They go out and they try to help people to implement strategies on fall risk, right? They go out and they install fire alarms. They do things to reduce the risk in the community. What we found as we were looking at data, that there were patients who were using the 911 system as really just a medical transport. That is, they were calling 911 a lot. And when we started looking at the data, we saw that there were a group of patients that were causing an enormous number of runs from the full fire rescue service. And in cooperation with our data folks and the field, what they wanted to do is find out what were the drivers of this. Why were people calling 911 over and over and over, and oftentimes within 30 days of having gotten out of the hospital? What they learned was that, and this is something that around the country we're seeing, there's this recognition that the social fabric around medical care needs to be bolstered. Because we found that a lot of people, it was very simple things. They didn't have someone to take them to their doctor's visit, so they didn't follow up with the care they were told. They didn't have their prescriptions. They didn't know how to get them. There were medical errors that they were committing in terms of medications, or they just simply couldn't care for themselves. And the chief will talk to this in very clear terms, but what we really found was that by a little bit of interaction with a community paramedic, particularly after someone's been discharged from a hospital, that we could help to solve those issues. So when our community paramedic would go in and meet with the patient and find out they have no one to transport them to their doctor's visit, we would arrange for a car, medical car, to take them. If they didn't have their prescriptions and hadn't gotten them, we'd get with our social workers. If there were issues in the house that were creating problems for them in terms of fall risk, we would start to address those issues. And in a very rapid period of time, and I'd say within 6 months, what we found is that 80% of the 911 calls that resulted in 3 fire rescue personnel going out to transport somebody to the hospital had been reduced. And that is not just good economics, right? Where it's good because we don't have the fire department deploying 3 people for this visit. We never fully get back the cost of that. Each hospital admission, right, even going to the ER is roughly $6,000. And if they get admitted, it's even more. What it really was is better care, because we were getting to the issues that create the medical complications that create it far more expensive. And we were doing this without providing any direct medical care in the community. We're simply addressing the social fabric issues. And this has been incredibly successful, and we'll talk more about the different models and what we do going forward. But in its simplest form, it was simply a matter of identifying those vulnerable patients who were frequently using 911 to simply get basic medical care and providing interventions.
Chief John McNamara, let's add on to what the mayor has just said. Let's talk about that.
Absolutely. So, as the mayor was saying, the fire service has always been at the forefront of risk reduction type of components, but typically on the fire prevention side of things, the smoke detectors, installing sprinkler systems in buildings, things of that nature. We decided to try to take that same risk reduction approach on the fire side and apply it to the emergency medical services side. So about 5 years ago, as the mayor said, we're very data-driven. We began to look at a lot of the data surrounding the 911 calls coming into our service and the type of responses we were providing to that. And what we discovered was over 30% of our 911 EMS, emergency medical services related calls, were attributable to repeat calls. More than once, many of those not just within 30 days, in some cases within 72 hours. And it was for a broad variety of reasons. It could have been something as simple as they still weren't feeling well, they slipped and fell, or they didn't understand, as the mayor was saying, their discharge paperwork, etc. In addition to that, another high percentage of that were fall with injuries, or somebody that simply fell out of bed and needed to get help back into bed. When we discovered that, we were actually taken aback. We were a little bit surprised that the numbers were that dramatic. From there, we decided to deploy, at the time, was just a person that we had working Monday through Friday to begin looking at these calls and just simply cold calling patients, calling them up, introducing who we were, talking to them and asking them their personal needs. From there, it truly exploded. We began doing numerous house call visits. We began collaborating with our field personnel. I'll talk about that momentarily, of how we identified patients a little bit sooner. We then began developing even relationships with the hospitals. As you're aware, back 4 or 5 years ago, as part of the Affordable Health Care Act, a lot of the hospital components were focused more on their readmissions of patients within these periods of time that were impacting them, obviously, from a logistical, fiscal resource component. So we decided to develop some relationships with our local facilities that we typically transported to, and started meeting with them to determine how we could better coordinate when patients were being discharged from those facilities, coming back to our particular community, and then putting them in what we termed at the time called our Resource Access Program. Was essentially the terminology we used, especially back in 2015, 2016, the community paramedic / community paramedicine concept was really not a term that most people understood in Florida. So we termed it at the beginning our Resource Access Program, where we began identifying resources tied to the people within our community, because what we determined was they just didn't understand the access to it. And from there, we have just continued to follow a very similar model in finding patients that meet these types of categories and then interjecting a person in the pre-hospital setting, but hopefully prior to them needing to inundate the 911 emergency medical system.
What really got me about the article that was written by you, Mayor, was the unfortunate, and I believe it's really unfortunate, non-knowledge as to what 911 is really there for.
I think that the point of this one, when we went into it, was not a judgment in terms of the patient, were they abusing the system. It was that in many cases, particularly for seniors and in socioeconomic conditions, they had no other choice. And in some cases, it was because the medical condition had gotten worse. They hadn't gone to their doctor. They hadn't gotten their prescriptions. And so, importantly, at no point were we looking at these calls and saying, here's a patient that's abusing the system. We're assuming, just like the rest of the nation is enduring this, that there are patients who use 911 because they have no other choice. And it's not just the utilization of 911. Hospitals across the country, particularly public hospitals, right, who cannot turn away patients, are enduring very high utilization of the ER as primary care. And we know that that's not economical, right? That is not good medicine either. So from our perspective, as the chief pointed out, it was about developing a relationship with the patients, with the hospital, but understanding what are those needs. And I think that's why you're seeing around the country a number of different models where it goes from everything from trying to provide direct care in the community, that is, the community paramedic team has maybe an advanced registered nurse practitioner who rides along. They're actually doing health checks. They're able to use telemedicine to get with a doctor from the person's home or their apartment, all the way down to this, which was really just about resources. This was the low-hanging fruit from our perspective, where we didn't have to put doctors or nurses in the field. And the point of what I was trying to raise, and what we're trying to raise here today, is that there are some strategic moves that can be made to not only reduce the hospitalizations, but provide better care that don't cost lots of money. The real challenge is, we're lucky in Sunrise that we have the resources to do that. What do you do in communities and zip codes where they're financially challenged, where maybe their population, because of socioeconomic conditions or age, are very heavily burdened that way, and they don't have the capacity to do it? Providing better care and better economics in the healthcare system should not depend on the zip code. Instead, what we have to do, because our community paramedic who goes out in the field doesn't have any reimbursement, the city's funding this. There are models around the country where state legislators make the decision that the value of this should be reimbursed at some level. And until we can get there, right, it should not be in this county or any part of the state that it's dependent on whether the city itself has enough resources to help provide better care. To us, we think that's the next big step. And then each community can craft what they think works best for them. What Weston needs will be different perhaps than what Sunrise or Lauderdale Lakes or Fort Lauderdale needs. But the important issue is, when you look at the skyrocketing healthcare costs, right now, healthcare costs are 18% of our gross domestic product. It is almost triple of other advanced countries. And in large part, it's because of how we handle healthcare. When you look at those other countries, they provide a social fabric around it, right? Maybe it's home health, maybe it's additional medical education, maybe it's additional touches on the patient to reduce their healthcare costs. Our model can do that very dramatically, but it's the first step in our opinion.
Very interestingly, I'm sure you know of Tax Watch, which is in Tallahassee. Mm-hmm. It's a representative body that really it's dominated by, and rightfully, these people step forward to do the right thing, large corporations and retired elected officials and things of that nature. And one of the main foci of Tax Watch over the last 3 years has been telemedicine. Now, why? It's very simple. It relates to something that you just said. If we had more people understanding how to communicate rather than just using this traditional phone, all right, it might be again, I don't want to say oversimplistic, it might be an easy way to have a watch or a band on that could do an EKG or a blood pressure, whatever. I don't want to get into the details, but we could get people who are overutilizing a system that is used to protect them and their property in very heinous times, often, not always, but often, and make the 911 EMS paramedic system a much more focused system on its original intent.
Yeah, and I think the chief can talk to that. I mean, part of the idea was that if we're not running that many calls on repeats, it means the units are available for more serious medical emergencies. Now, they're always going to meet that mission, right?
Right, I know that.
And we work with other cities to do that through cooperative responses. But the point is, it's not the best use of our taxpayer money, right? Funding 3 people to go out for a medical transport because they didn't get to the doctor. And it does have this constant pressure about whether we need additional units on the road to meet these repeat callers. And I think the chief can talk to that. But in the end, it wasn't so much about savings or making sure we can get to a call quicker. It was that this was good medicine.
Right.
And we had to reduce the touches by the ER as a primary care. It's just bad economics for us as a society.
To follow up on that, it's interesting. The fire service has always prided itself on being community problem solvers. We're actually humbled in many ways that people call us when, quite frankly, sometimes they feel they have nobody else to call. So that's a very humbling, obviously, feeling to be in that line of work. What was happening is we would continuously go out on calls, and we began to feel like we really weren't solving community problems. In many ways, we were unintentionally, exacerbating the problem because we were only showing up because obviously that's our mission. They needed some kind of assistance. Our only avenue was transport you to a hospital. So our own people internally began feeling that helplessness of, we have to try to do something different. And the typical response of, as calls for service increased, the challenges of putting more units on the road, yeah, there are fiscal impacts, but it really came down to personnel in this profession saying, we could do something better and truly impact real problem solving. And I think, as the mayor indicated, from a legislative perspective, in supporting that mission, there are significant savings. Obviously, it depends on the area, the type of governmental service that provides it, but there could absolutely be some ancillary significant savings on the service delivery system. Because of units not being overused for these maybe lower prioritized type of calls. So now they're more available to handle the calls you just mentioned, although they may be limited for the higher prioritization of those calls, which is obviously a very, very significant benefit. Where it also could lead to eventually is maybe an additional level of education of what the 911 system is used for, and moving towards a system where maybe 5 or 10 years down the road, not where someone would feel they can't call 911, but when they call 911, they may be able to be directed to a community paramedic that can now drive out and meet you at your house in a 30-minute or 45-minute time frame, versus we find out 3, 4, sometimes 30 days later that you needed that type of assistance. And that may actually be differentiated simply with phone call techniques on how a 911 system can work in the future.
I think the people out here don't realize that what you're talking about, Mayor, and people showing up at the ER and using that as a primary care, I guess, venue, the dramatic costs that are brought to them personally, but also to the community. A lot of people mistakenly believe that the public hospitals, because they're wide open and they must take patients, that these people are getting free care. Well, they're not getting free care because you and I and the people who are watching, it's all in our tax bill.
Right.
All right? Because what happens is uncompensated care then is figured in by the insurance companies in their usual and customary number. I'm getting a little too technical here. But what happens is your insurance policies go up as the uncompensated care number goes up in a region. People don't see that.
Yeah, and there's 2 points there, right? So one issue is emergency room care is incredibly expensive. It's over $6,000 for just a routine. But if we are able to prevent even the visit, that is the complication that led to it, there's not just the savings of them not going to the ER. We're trying to prevent hospital readmissions as well. So the numbers would take a higher educational institution to really delve into what those numbers look like. But we're fortunate because there are models around the United States, Minnesota and Texas and Indiana is starting, that they understand that for the Medicaid system particularly, they need to do something to reduce these admissions, and this community program is very effective. And I'll give you one great example. You mentioned healthcare costs. Just recently there was a report in the New York Times about United Healthcare, and they were trying to manage their Medicaid costs, their reimbursement. It's always a loss leader for them. They actually decided to start a pilot project focused on the homeless. When they looked at the homeless and public hospitals, they were very significant drivers of high cost interactions. You know, $50,000 or more a year for a single individual. And what they did is they went out and they got an apartment building and they found 60 rooms and they started taking those high frequency, high utilization patients and giving them a place to live. And in the early setting of this, what they found was through case management work and otherwise, they were reducing very dramatically, not only the hospital admissions and readmissions, but the cost of care in very stark terms. And using, as the chief pointed out, using data, trying to understand the patient needs, this is not a social welfare policy. This is good economics for you and I on our tax bill, as you point out. And so we're seeing a lot of ingenuity out there because of the skyrocketing costs and the difficulty controlling it. What we really need to do is have a state policy on this that focuses on how we're going to prevent readmissions and we're going to provide better care to reduce the tax burden on us as residents.
I really would like to offer you the opportunity for your city and for your goal, Mayor, of trying to bring maybe a group together, an initial group. You want to get other mayors involved throughout Broward County. You're welcome to use one of our facilities. We'll provide you with some lunch or whatever it is, and let's talk this thing out. Because there are good people around that are driven by the good works of the fire chiefs, the police chiefs, and the hospital corporations as well, because they're the ones that, in essence, they're the ones that are suffering. The people don't realize that their costs are up because we have public hospitals. I don't want to get into the detail, but it really is there. I'm only offering you, on behalf of Nova Southeastern, the opportunity. We could do metrics for you. We could do a lot of things. Just ask us, we'll do it. We're down to the last 2 minutes of the show. I just want to say one more time, I've got to say it, how much that my heart and soul, and I'm talking for the people out there, feel, Chief, about our fire people, the folks that answer to your call every day, to you, Mayor, to the hiring of great police chiefs. You know, without them, our life is not as calm and as safe as we would like it to be, and it has nothing to do just with these horrible shootings and things of that nature. I'm talking about day-to-day activities. So I want to thank both of you for your advocacy. I think that the community paramedic program that you're doing at the City of Sunrise needs to be replicated. But first we have to shine a light on your program. And let me help you.
We're extremely grateful, and we know that there are other communities that will join under your leadership to do this.
Well, I'm not looking to lead. I'm just looking to follow your ways.
Thank you.
Folks, I hope that you realize that this program was designated as a service to you because it really relates to the health of the community. Thank you both, Chief. What can I tell you?
Appreciate it.
You know, I'm so proud of this young man. And John McNamara, thank you very much for doing what you do on a daily basis. And Michael Ryan, what can I tell you? You know, you're a supreme guy. Not only the mayor of the City of Sunrise, but one heck of an attorney. And I appreciate all the good work that you do for the community. I really do.
Dr. Lippman, I'm just happy to work with you again. We've worked on great issues, and this is a great one for us to work on together.
Well, let's do it. Okay?
Perfect.
Folks, I hope you have some interest in what was being presented here. Please, if you have any questions, you have any comments, there's an email address and a telephone number right here. Let us know. We'll send them on to Mayor Ryan and Chief McNamara, and we'll see if they, you want to talk with them. I'm sure they'll talk with you. Remember, this program is called Dateline Health. I always tell you to take good care of yourself. In this case, pay some attention to what was being said today, and I'm sure that you're going to be taking better care of yourself if we can get something done so that the first responders, namely the chiefs, fire people and paramedics, as well as the police, can get involved in making your day-to-day life safer and happier. This program is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.